live. Hello, everyone, and welcome to Samantha Politics, a show where we talk about global politics and women's rights. We have a great show coming up.
On the military for the genocide against the Rohingya. So,
as these poor people are being attacked, people are hiding in their offices. You guys saw a guest.
We're going to be talking about Burma and Russia today, but just a quick U.S. Native American Secretary of the Interior. Now, this is really monumental because
I'm Samantha Carlin, your host of Samantha Politics, and we'll see you next week. Take care, everyone. Bye-bye.
Hi, everyone, and welcome to this week's episode of Samantha Politics. I'm delighted to be here with two amazing guests, one who is on the ground right now in New Delhi, India, where the COVID crisis there is spinning out of control, and an amazing humanitarian photographer who's going to tell us what it's like to be on the ground in the worst of situations. But before we get to India, I want to give you some brief global updates on what's going on around the world. So the first thing that happened is that Chloe Zhao won Best Director. She was the first woman of color to ever win Best Director at the Oscars. I think this is particularly significant because she's Chinese, and despite all of the anti-China rhetoric and anti kind of Asian American rhetoric that we've had, she was still able to win. Then again, those people that vote for the Oscars are an enlightened group and maybe not the anti-Asian among us. Interesting twist with Chloe is China. So she's from Beijing, so you would think that China would be delighted that somebody who was born in China was winning the Oscar for Best Director. Well, initially, as she started to gain success in film, they were overwhelmed and excited about her and putting her up there as some kind of, celebrity, until they got hold of a 2013 interview in which basically Miss Zhao castigates China and says that though she was born there, it's a place where there are lies everywhere. China obviously did not like that too much. No longer is she a golden child in China's eyes. So they've now deleted and gotten rid of all social media posts that are congratulating Miss Zhao's win in China. So kind of interesting foreign policy twist to that Oscar win beyond just her being the first woman of color. I do think that's a really amazing thing, to have a woman win Best Director, but also a woman of color. And hopefully that's a trend that we continue to see. Something else that happened internationally that's also really important is that President Biden has finally acknowledged the Armenian genocide. Now, what was the Armenian genocide and why is that a big deal? So in 1915, the Ottoman Empire was dissolving. And so as lots of states like to do when they want to hold on to power, they decided to blame it on the intellectual minority, which happened to be the Armenians. So what happened? They went on a large-scale campaign, executed hundreds of Armenian intellectuals. This is in 1915. Tons of others were deported. Numbers put about 1.5 million Armenians as having been killed by the Ottoman Empire during the Armenian genocide. Now, 29 other countries have already acknowledged the genocide, so what took the US so long? Well, Turkey is kind of the daughter of the Ottoman Empire, and Turkey doesn't acknowledge the Armenian genocide and says that the deaths were a result of civil unrest, plays down the numbers. It's been this clash between Turkey and Armenians for a very, very long time, and Turkey is our NATO ally. However, the last administration had a really great relationship with Turkey. This administration, not so much, because we don't like Erdogan's hard line. So that's why it hadn't done in the past, but Biden is finally making it official. There was also a congressional resolution before this that authorized it as a genocide. I think it just something that's really important to think about. I met an Armenian guy on a plane, and he was sitting next to me, and he was a researcher, and he literally had brochures and small books that were about the Armenian genocide, and he just went giving them out to anybody. And he was a PhD, and there's when there is like large scale human rights abuses or large scale murder within a country, it means so much to people who are relatives of that, or who are from that ethnic group, to have the international community acknowledge what happened. So I'm sure this was incredibly moving for many Armenians and relatives or Armenians or ancestors who were killed in the genocide. And I'm also wondering, does this mean we're going to take a harder stance in general around the mass murder of people by their governments? Remains to be seen, but I think that that's a really, really positive thing that happened. Zach, to the next picture. Update on Ethiopia. So a few weeks ago, we talked about how the conflict that's going on in Ethiopia, and how one of the things that was contributing to the conflict was Eritrean troops that had come in to help the Ethiopian armed forces, which was resulting in large-scale human rights atrocities and abuses. Eritrean forces were specifically implicated in a lot of these, and when we had the show, we talked about how our Secretary of State, Anthony Blinken, had just gone and had negotiations with the Ethiopian Prime Minister Abiy Ahmed. And he'd said, okay, one of the things we'll do is we'll make sure that all of the Eritrean troops withdraw from the country. Well, at the time, my guest said basically fat chance. And guess what? She was right. Have the Eritrean forces withdrawn from the country? No, they have not. So, just an update now. Blinken is really trying to put on the pressure to lead to a ceasefire of hostilities and to get the troops to actually withdraw. And I think it's just an important point to know that just because a prime minister or president says, "Oh yeah, we're going to do that," doesn't mean that it's actually going to happen. So let's move on to the big part of our show, which is about India. Zach, if you could cue that slideshow. Yesterday, India recorded 360,000 coronavirus cases, the highest single day total of cases recorded globally so far. It has been racing through the country at an extremely alarming speed, a speed so fast that no one predicted it, and no one's ever heard of anything like this before in terms of how fast it's just ripping through the population. Since the beginning of the pandemic, India has had more than 16 million cases and over 200,000 deaths, supposedly. Now, that's what the official statistics say, but even on a daily level, official statistics put about 2,000 people dying a day. But if you look at these photos, it is such a disaster there that some health officials are putting those numbers at between 10,000 and 15,000 people dying per day from COVID in India right now, which are staggering numbers. And all this when the rest of the world, I mean, I had my second COVID vaccine dose today, when the rest of the world is moving on, India is at the absolute worst that it has ever been in the COVID pandemic right now. As you can see in the photos, it is a complete and total nightmare. One writer said, if the apocalypse had an image, it would be the hospitals of India. And the pictures are just terrifying. There's an extreme shortage of beds and a huge shortage of oxygen, which means that people whose lives could have been saved just with proper care are dying waiting on stretchers outside the hospital or in ambulances because they're not able to get oxygen. We feel as Americans far away from this sometimes. And then even me, one of my friends from India who showed me around Ahmedabad, which is where a lot of the crematoriums are now, and was a lovely guest, his mother passed away 2 days ago from COVID-19 in India. I mean, it is just, everyone is connected to this. There's also reports of people stealing or hoarding oxygen cylinders for their sick relatives, or even just in case their relatives get sick because they don't want to take the chance that there won't be oxygen. There's grassroots efforts popping up all over the place to say, oh, there's hospital beds here, there's oxygen here, and then 2 seconds later they're gone. The crematoriums are also overloaded, and sometimes you have 30 to 40 bodies that are being cremated simultaneously, as cremation is an important tradition in Hinduism. Zach, if you could play that clip of the crematoriums.
ये हाल कभी नहीं देखा, कभी नहीं देखा ये हाल, कभी नहीं देखा. कोई ऐसा कोना नहीं और बाहर शवों की लाइन लगी हुई है. यहाँ पे एम्बुलेंस की सारी पार्क खड़ी है.
Just unbelievable. So you can see those little kind of teepees or where bodies are being burned right now. So what is the international community doing? Well, with lots of mounting external and internal pressure, and Biden and Prime Minister Narendra Modi supposedly just had a call yesterday, the U.S. is now sending drug treatments, rapid coronavirus tests, and PPE to the country, as well as raw materials for it to create more vaccines. The US also under a lot of external pressure, because the US has plenty of vaccines. I don't know about you, but I've gotten at least 10 emails in the last 2 days being like, get your vaccine here, get it here, get it here, get it at Safeway, get it at Walgreens, get it at CVS. We've got plenty of vaccines in the US, and we have this huge stockpile of AstraZeneca vaccines which haven't even been used, because the US is using Moderna, Pfizer, and Johnson & Johnson, although Johnson & Johnson briefly stalled. So under mounting external pressure, because all these countries that don't have vaccines, the US has said that we're going to export 60 million doses of the AstraZeneca vaccine once it passes federal review. And it's likely that India is going to be the recipient of a lot of that, those doses of vaccines. The UK is also sending over 600 medical devices like ventilators and oxygen equipment. It's nice to see America finally taking a role in trying to help the international community, since in the last 4 years, we could barely help ourselves. And we certainly didn't take a role in stopping COVID internationally. So without further ado, I'm going to bring in live on the ground in New Delhi, Huma. She is a senior journalist with 3 decades of experience on reporting in foreign policy and military diplomacy. It's also 4 a.m. for her, so I really want to give her a big thank you for coming onto the show.
Thank you.
Thank you so much, Huma, for being with us. So, you're on the ground in New Delhi now, correct?
Yes.
Can you describe for us the scene? What is going on there?
It's like really a bad situation here, because there's a lack, one never anticipated that this COVID situation is going to get so much out of control. It's really, there are no hospital beds available, there's no oxygen, there is no critical medicine available. So people are just dying, and you have just shown the images of the cremation ground, and that's the ground. The electric crematoriums have melted because there are too many bodies which were being
Wow.
it's like really bad. And this is something that I think we never expected this to happen, and now it has happened. So we don't know I don't know how exactly I can describe, but yes, the numbers went, there were numbers in the month of March, and by the time April came, it like erupted like a volcano. So I think even the hospitals didn't know, how to handle too many cases. There were COVID hospitals, not in the initial few weeks, but now there are COVID designated hospitals, but there are no beds, there are no oxygen, there's no ICU. Where to go? So you stay out.
I heard that the Indian government is potentially going to put people in railway cars. Is that accurate?
Yeah, they had to. There are special railways where they have made they have put these beds where you can you can go into. But then where there's not too much information around it, but yes, the government has put the railways out there. Railway coaches are being readied, and they are ready in some parts of the country. I think mostly towards more towards inside north. There are trains, yes, which have been put on standby to take patients there.
So Huma, you're a smart woman and a fantastically accomplished journalist. How do you think this happened?
I blame everyone for this. Let me be very. I mean, mostly we see people. There's a lot of what would you say? We thought that we have won this battle against COVID, so we became complacent. Okay, then a callous attitude. We decided that we need to have a lot of election rallies. We also decided that we need to go in for religious, big religious congregations. We decided that we don't need to wear a mask. We decided that everything is fine. So here we are. The election commissioner decided to have elections in state, large number of people gathering for all these election meetings, and that too without masks. Some places they may be wearing masks, but if you go to West Bengal, as per the reports coming out in the media, which you also must have read, every second person in West Bengal today is COVID positive. So why did they go there?
Wow.
Because the election commission decided. In fact, I'm not saying this. In one of the courts in down south in Madras, the Madras High Court has actually declared that Election Commission of India should be held responsible for so many deaths and the increase in number of COVID positive. So that's the way it is here.
So, you mentioned West Bengal. I had seen in the news that the BJP chief had advocated drinking cow urine as a
Yes.
way to treat COVID-19. I mean, that sounds so scientifically sound and also disgusting. I mean, do people believe that? Do they actually go out and sip the cow's urine? Like, do the people believe that? I'm genuinely curious.
Some people believe that. Well, I mean, not like it's not as if I'm kidding, but yes, some people believe that, and people do consume it. Not the cows which are walking on the road, not like that. These cows are raised in a special environment, and they're fed not the garbage, but proper grass or whatever they need to be fed with, and that's the and whatever urine they pass, people do drink. They do drink. I mean,
Unbelievable.
no,
Um,
I mean, and they have a faith. That's why they say. That's why in India they worship cow as the mother.
Right.
So for some people, when if you go and tell them, if you have cow urine or cow, I mean, I don't know what's the word for it, but I won't talk much about that. But yeah, cow urine is considered to be good, but for what, I don't know. Scientifically it's not been proven, but yes, people do worship cows here, and so anything related to the cow, they will take it.
Interesting. Another thing you mentioned is religion. And so, in the US, we've had, during the COVID crisis, we've had a spate of Supreme Court rulings that basically, and also just things where, the Orthodox Jews, and I'm Jewish, but the Orthodox Jews wanted to still gather and still have a minyan. And, and the Supreme Court ruling that religious groups were okay, even though at the sacrifice of public health. So it sounds like some of that has also happened in India of prioritizing religion over public health.
Yeah, like I said, everyone is responsible for the mess that we are in. There's no one particular, person that I can say, okay, this is the guy, let's blame this person. The thing is that, we, like you said, religion is now over and above the public health. People are, there are these religious congregations which you see, which again you must have seen on television out there in the US. But here, you have the Eid, the month of Ramadan is going on, so people are going out and in the middle of the night they're going out to do shopping. Then you have the Kumbh Mela congregation. Then you have other festivals like the Holi, the festival of colors, which means a lot of people are coming out, and there's no social distancing, there's no masking up. And I tell everyone, mask up. But that's the way we humans are. We think that nothing is going to touch us, because there was even one again, it was on television, one person, one politician, he came out and he said, oh, we can have the Kumbh Mela, but in this place. But why? Because it's a belief that nothing is going to touch them. Now, can you
Yeah.
imagine these people going out from the Kumbh Mela back to their villages? They
Right.
go into the interiors. Here, what the numbers you are seeing is the numbers that you see from the cities. I don't know what's happening in the interiors. So
Yeah.
these people are the super spreaders who are going from, whether it is the Ramzan crowd, whether it is the holy crowd, whether it is the Kumbh Mela crowd, but these people are going back somewhere, and they are the super spreaders.
Yeah.
The
So
super
Huma,
spreader right now is are the people who are aimlessly walking around without putting other people's lives at risk.
now Huma, I just want to actually air that video you sent me that is of the Kumbh Mela festival, right? Or
I don't remember. Could be. I don't remember.
it's one of the gatherings. We're gonna see it and then let's talk about it in a
Okay.
second.
Okay.
Okay. Zach, can you play that second video for us, please? All right. So first of all, can you give us a little context, since I have no idea what the guy is saying?
No, this is an election rally.
Oh, that's an election rally. Okay. So what is going on there?
And he's the person is saying, Bharat Mata ki jai, like basically saying that India is great. So that's what he's shouting in the background.
And you said that this was last week, this rally?
Yeah, this was just last week.
Wow.
Last week, 10 days ago. Yeah.
Unbelievable.
So that's what I'm saying.
Yeah.
It's, that's why the Madras High Court gave out this judgment that the Election Commission of India is responsible for the number of deaths that are happening in many places, because the crowd is out there.
Right. But that doesn't, change anything for the people whose
No,
friends and parents are dying.
Apparently not. Apparently, people just think that it's a joke.
Yeah.
They're not taking it seriously. I don't know why they didn't take it seriously, but you can see the crowd. They're not wearing a mask. They're not masking up.
Now, Huma, I have a question for you. So it seemed like, a lot of people are talking about how India did relatively well last April when this first came out, and there was a strict lockdown, and people did seem to observe the lockdown then. But now they don't care. Why do you think the disparity?
The way I see it, okay, this is my personal way. The way last year we managed to control it because there was a strict lockdown. All the borders were sealed. Okay, there was no movement anywhere. So much so that, as you know, even the airports were sealed. Okay, so there were no inward flights, no outward flights till I think August, September they started it. Then things, started calming down. Things were getting under control. Everyone thought that COVID has gone. There are no numbers. There was no surge anywhere. And then fast forward, we come to January, and the numbers started, going up gradually. And this is again because there were too many people. Suddenly, people became, like I said in the beginning, everyone became so callous, everyone became so complacent that they stopped social distancing, they stopped wearing masks, they couldn't care less. We let our guards down, the virus continued, in fact so much so, even the parliament session, the winter parliament session in India was not held because of the COVID. We were told the COVID, there won't be any session parliament. It was decided because of COVID, but come March, and the numbers started growing, going up. And again, it's all because of the election. I personally blame religious congregations, election rallies, people letting their guards down. These are the three
Mm.
main things. No, I mean, the protocols that were there should never have been removed, but they were removed. I mean, they were not removed, but people started going out to work. People started moving freely. They had to open that, but then we couldn't care less.
Mm.
Like you see in the US, everyone is fighting, oh, we are not going to wear a mask. But now, what is happening in India? The attitude that we will not wear a mask, now everyone has to wear a mask. There is no way you can go out without double masking. Now, the doctors are asking you to double mask, and they are even asking you to wear a mask while you are inside your house. So, how do you like that?
Wow.
Yeah, so we have been told that it's advisable to double mask when you step out, and even when you are within the four walls of your house, you better mask up. So
Now,
now,
yeah, one of the things we talked about was the cow urine, but was also, what has been the role of disinformation? Like that's one of the things in the US of disinformation around vaccines, around masks, around, it's a conspiracy to God knows what. What has the role of disinformation been in
see,
this?
I would blame the social media. Okay,
Mhm.
I would blame the social media for a lot of disinformation regarding this COVID. Okay, the thing is that if I were to send you sample of messages that we received last year related to COVID, you will actually be shocked. But I was told that these are similar messages which are going around the world, which is total misinformation about the COVID. And then it started about the vaccines. The thing
Can I
is,
stop you for a second, Huma? Like what kind of misinformation was about COVID that you were
like
getting on social
again,
media?
like conspiracy theories. Again, it has been done deliberately. It has been done to ruin India. It's only India specific because every country was imagining it is only specific to them. What no one was imagining was that it's a global pandemic.
Yeah.
Oh, China is doing this because China is next door. Don't forget, China is a stone's throw from my, I mean, it's my neighbor. So we were, all these messages were going around, and then, if you have COVID, you have this, you'll be fine. Don't do this. Just sit here, look this way. But that's not the way to deal with COVID. Till the government started, coming out with proper information that this is what COVID is, this is what social distancing is, and it was done very well. That's how we managed to control everything. But then, fast forward 2021, we messed up. we
Mm.
we messed up because, again, like I said, I blame the social media. So we are watching the news, in the US, everyone is fighting, we don't want to wear a mask, people protesting, why are you forcing us to wear a mask? But why shouldn't you? My problem is, why shouldn't you wear a mask? What kind of a health condition says that you should not wear a mask? I have a problem. I cannot breathe through my nose. I breathe through my mouth, yet I double mask up. So my doctor tells me, if you are double masking while going out, why can't you mask up inside your house? Because, again, the houses in India, the apartment buildings, the rooms are not very big. They're small. So you have
Wow.
families staying in. Sometimes it could be 4 members, 5 members, 6 members. Now, since they say that the virus is in the air, they are trying to tell you to mask up. People are finding it odd. They're
Mm.
saying don't go out, but we want to have weddings because this is the wedding season. If I will send you a very funny video, you must watch it. It's really funny. because as section 144 is in place, which means that more than 4 people cannot gather, yet people are going ahead and getting married. And in India, getting married means a huge wedding procession, but because of section 144, they cannot go more than 4 to 5 people. So I'll send you a video which you must watch and laugh, because there's just the groom on a horse, the man who's leading the horse,
Uh-huh.
and 2 men with the drums. That's it. So 4 people.
But so if there's this mandate that there can't be more than 4 people, is the Indian military or the Indian police, are they cracking down at all and saying, you can't do this?
Where the election rallies were happening, obviously, there's nothing there. There was no section 144. Where I stay, there is section 144, and you cannot congregate more than 4 people. Right now, there's also a lockdown in place, so people are obviously not going out, but people are still going out who are desperately looking for oxygen cylinders or medicine. So they are going out, running around from pillar to post looking for those things. So yeah, you don't have that entire population out there on the Delhi roads as you would see on your TV screen several times, but section 144 is in place. Delhi is total lockdown. Delhi, which is the capital of India, is totally locked down right now till May 3rd. But the Delhi NCR, which means the what would you call the suburbs, they have section 144 in place. You cannot go. Not more than 4 people will be, and the police is there. They will beat you up if you go out unnecessarily. Yes.
Now, where does one get an oxygen cylinder?
Typically, they are, hospitals have the oxygen, and so if you want to buy, there are these distributors, there are these places where you can go and buy medical oxygen cylinders. There are distributors for that. So that's where people are running around to look for those
But then
cylinders.
why don't the hospitals have the oxygen if there's distributors with oxygen?
Yeah, like I said to you earlier, all the hospitals have oxygen cylinder, but now there's a huge shortage. At least till last night, there was huge shortage of oxygen in Delhi NCR. When I say Delhi NCR, I mean the adjoining places to Delhi. There was a huge shortage, but now the oxygen has started coming from different states across the country. So hopefully there won't be shortage, but yes, there was. So what they started doing was running around to these distributors to collect the oxygen cylinders and taking it home to their patients, because the hospitals ran out of beds. So now people who are self-quarantined or who have been asked to home quarantine and there's a need for oxygen cylinder, you have to go somewhere to pick up those cylinders. The cylinders are not going to come to you. You have to go and pick it up.
Wow.
So you go and pick it up, which is being sold in the black market. And so you go and pick it up, and if you're lucky, your patient will be saved. Otherwise, a lot of people have died home because there was no oxygen cylinder outside. I mean, they just couldn't get it. The hospitals ran out of it. You have seen the images.
Yeah, just awful.
Where all these Sikhs have created a place where you can go and have oxygen. What they call it as oxygen langar. Langar means, the Sikh religion has a thing that where they distribute free food to anyone who wants to eat, anyone at any time of the day. So they have created these places where you just go in your car, sit in your car, they bring the oxygen to you, they give you the oxygen, you take the oxygen, and then you come back home.
Wow. So one other thing that you mentioned is so something that I had seen, was a crowdfunding effort by a bunch of entrepreneurs to purchase and supply hospitals with oxygen tanks. Have you seen that?
Yeah, a lot many people are doing that. Several
Interesting.
people, a lot of people have put in their own personal money. According to some reports that I read in the newspaper, a lot of people have, their retirement funds. They have just put all that in bringing oxygen to people who are, who are dying or gasping for breath wherever they are. And yeah, I've seen those reports. Yes,
What
they're
about
trying to do.
the difference between, like when I so when I was in India, funny story, I sprained my ankle and I didn't want to go to the emergency room because in the United States you wait for 3 hours in the emergency room and it's like it's horrendous, and I was like, I'm fine, just give me some ice. Anyway, so my friend Topish, whose mother passed, brought me to the private hospital, and he even paid for my X-ray. He was like, "Sam, it's like $40. Don't worry about it. It's not expensive." But it was super easy. But now they're saying that even if you have money, it's not necessarily guaranteeing you access to oxygen or to a hospital bed. Is that accurate?
Like I told you before the beginning of this program, a very rich friend of mine, very rich friend of mine, his mother could not find a bed in the hospital, so she just died. She died at 3 a.m. at home, lack of oxygen,
Wow.
because there was no bed in the hospital. Money does not guarantee you any hospital bed. You have to be a VVIP to, you will get it, not a problem. But if you are a middle class, upper middle class, I don't think you will be that privileged to get anything. Money is not a
Yeah.
thing here. For anyone who is saying, oh, he is rich, that's why he got, maybe not rich, maybe a VVIP.
Mm,
It's
mm.
not about the money here right now. I mean, rich people are gasping for oxygen. And again, because you see what has happened is that people got so desperate that they started converging in Delhi from other states. So Delhi already has a huge population, and then if you
So were
add
they
people,
coming to Delhi because they had more hospitals? Why were they coming to Delhi?
because Delhi has a lot of good hospitals. This is not to suggest that other places don't have hospitals, but it's always there. That if I go to Memorial Sloan Kettering in New York City, my relative will be fine. He or she is not going to die. But I still lost my mother in Memorial Sloan. So it's not guaranteed that if you leave your home and come to a different state, your loved one will be fine.
Right,
But
and you're
people
also
do that.
potentially spreading the
Yeah, so
illness.
people
Yeah.
came. So what happened? There was a huge burden on the infrastructure, um, um, uh, in Delhi, and which is why the hospitals ran out of, the oxygen, whether it's the bed or the oxygen. So yeah, that's the way it is.
So what can be done at this point? I mean, what can the average person do, and what do you feel like the international community can do to help India?
You know what? Two, three things. Again, my personal opinion. I tell everyone that who talks to me, the two, three things, two major, three, four things, very critical. Of course, the government has now announced, has announced that anyone above 18 is eligible to get the vaccination. Okay, thank God, because vaccination was another reason why it didn't come out in time, and a lot of people were denied the vaccination because of the age limits that they had put there.
So
And
sorry. So what was the age limit? You had to be a certain age to get the vaccine?
earlier in the first phase, it was 60 and above.
Okay.
Okay. Then they gradually opened it, it was 45 and above. Now, when the cases are going up from May 1st, it will be 18 and above. So we don't have that many vaccines to be administered. So we need to push, for higher production, which is why, a lot. Meanwhile, America, the Biden administration, the initial, stage, they refused to. They put a ban on the raw material that was required to make the vaccine, AstraZeneca a vaccine, which has to be made by Gilead, Gil-
Gilead. Gilead.
Gilead. Yeah, yeah,
Yeah.
okay. So yeah, they were, so now they have been pulled in. They have decided that they will help India, and they will help in whatever vaccines are required. So and a lot of countries, Russia rushed in, UK rushed in, France rushed in. Everyone is offering whatever they can to help. So coming back to what we can do, we need to mask up. We
Mm,
have to mask up. We have to maintain the social distancing, no matter where you are. Social distancing is very important. It's not a joke. Like in America, I see people, sort of dissing each other. But the thing is that you don't realize you may be fine, the other person may not be fine.
yeah.
So yeah, so social distancing is important.
Has
Masking
that
up is
Huma,
important.
has it become political at all like it has in the US? Like in the US it's like, oh, if you're, a Trump supporter, you don't wear a mask. If you're
No,
a
no, no,
liberal,
no,
you
no,
do.
no, 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 no,
Okay.
not like that. It's not like that. It's just that people say, oh, if you can have such religious congregations, if you can have political gatherings, no one is masking up. Then why the hell should I mask up? But
Mm,
what has happened in Delhi? They started, imposing fine on people who were not masking up. So much so that the court had to
mm,
intervene, and the court said that we will fine you. $5, 10. Oh, I mean, 2,000 rupees is how much? Maybe $50. Yeah, and even if you're in the car alone,
mm.
so yeah, they started pulling up people and started imposing fine. If it was done earlier, if it was never removed, things would have been okay. And then stop these congregations, all these religious ceremonies. I couldn't care less who you are, because of your celebrations or whatever dramas you're doing out there, you're risking so many other lives.
Yeah,
And
absolutely.
yeah, and then now that the vaccination is going to start, the age limit has gone up to 18 now. From 18 onwards you can get a vaccine. Let's hope that we have enough to administer, because people right now are thinking that we have got the first jab. Do when is there enough for the second jab?
Mm,
Now there is this thing going on. But yeah, the international community is helping India, and they have come forward. Don't forget, we were the first ones to help the Americans when last year America was had a similar kind of a situation. We were the very first ones who
yeah.
came forward and offered it anything that you wanted. So yeah, right now we all need to stand together. It is not country specific.
Yeah, it really, some of the scenes in India just reminded me of when, the morgues were so full in New York City that they were putting bodies into like buses and vans
Yes,
because they had
yes,
nowhere to put them. Um,
absolutely,
it's
absolutely.
just,
So death is not country specific. Virus like a global pandemic, which is coronavirus, it is not country specific. So we all need to join our hands together right now. If any country says, "Oh, we are not going to help India," don't forget India was the first one to help. We were, and we continue to help. We
mm,
were like now Biden administration has announced that they will eventually export the extra dose of AstraZeneca, that vaccine that
AstraZeneca.
yeah, that's there now. After a while, they have announced this. But imagine sitting on those kind of, you have so many options, and you are sitting on that large number.
Yeah,
That could have
I
been
mean, it's
sent
unethical.
off.
I
Yeah,
agree.
you can
It's
just
totally
send it off
unethical.
immediately, and so I mean, again, it's my personal view. I'm not sort of blaming anyone, but I just feel that in these times everyone should be giving. It's not as if if you don't give me, and if you just say, eventually you will throw it, because these vaccines have a shelf life. So if you don't use it in a certain time, it's just going to go waste. Might as well use it. So let's hope that yeah, they have promised that they're going to send some to us, and this Gilead has also promised to help the Indian companies here to manufacture the vaccines here in India, and hopefully by the time first May comes, the 18 and above population will get their first jab. People are getting the jabs. Yeah.
Now, Huma, last question for you. I mean, you're a journalist, and we're going to transition into Babita after this, who's a humanitarian photographer. You sent me an article about how journalists are getting COVID at crazy rates. Can you talk about your personal experience, your colleagues' experience as a journalist, trying to capture what's going on?
See, so a lot of my colleagues who are in the field, who are covering out, they are going to mortuaries, they are going to hospitals, they're interacting with the COVID positive patients, they are getting exposed. Okay. So again, because there was a bar on the age limit for the vaccine, so not many of them were vaccinated. It's only recently when they raised the age limit to 45 and above. So not everyone out there was 45 and above. There were a lot of youngsters who got exposed. In fact, just 2 days ago, I lost two colleagues, young colleagues in the television, from the television world. And they became COVID positive because they were out there, the reporter along with the cameraman, they were there out there taking images of whatever, or making the report of whatever they were doing. But now it's bad out there, and it's because of the exposure. Because of the exposure to the virus out there in the open, because when you go out you see so many dead bodies in the mortuary where people are there.
Awful. And one
It's
other thing
awful.
you sent me was the CAT scans. I hadn't seen that before. So they were still doing CAT scans of people,
Yeah.
and then that was a spreader. That was really
Yeah,
interesting.
I mean that was a article in the newspaper which says that too much of CAT scanning is also causing this. So I don't know what it meant, but I did ask a doctor before I came on air here. Yeah, that person said yes, too much of CAT scanning, too much of it is also responsible, because you could be having another virus, you could be having something else, and now suddenly you go for a CAT scan, because and then it it aggravates. I don't know what happens, but that's what I was told, that CAT scan is another thing that is causing this virus to sort of, I again, based on what I read, I'm no doctor, so I cannot talk with authority on that. Yes, that is a problem. Yeah.
So, Huma, I just want to thank you so much for coming on the show, and I also just want to wish you health and safety, and that you get through this, and offer my condolences. For it must be so difficult to just lose people all the time and just never know kind of who's going to be next. Like, what a mental burden that must be.
Yeah, I just through your platform, if you allow me, I just want to say
Yeah, please.
something. Okay, wherever you are, please mask up, please, for God's sake. It's nothing personal. Okay, people are making it personal. Number two, mental health is real. People are going crazy. A lot of my colleagues are getting into that dark space. When I say dark space, they want to, sort of, when they see the people, like you just asked me, just as a final word from me,
Yeah,
when you
please.
said, people who are going out, the reporters who are out there in the field, they are coming back completely broken mentally,
Yeah.
forget emotional, mentally. And I'm sitting inside, I'm working from home, I'm going crazy in my head. You know why? Because every time you pick up your phone, you only see, news about death. There is nothing happy about it.
Ugh.
Okay, so through you, I just want to say mental health is real. Please,
Yeah.
guys, it's real. Talk to each other. Keep in touch. Keep a tab on them. Is every I do that every morning. Today I'm breathing. I bow my head in front of God in gratitude that I'm awake. I'm talking, and then the next thing I do is I start checking on everyone. Is everyone
Right.
okay? So that's all I just wanted to say. Thank you so much for having me on.
Thank you, Huma.
You
It's
take
been
care.
it's been such a pleasure, and I'm just really wishing for the best for India, and hopefully this episode will give people. We are putting in the chat shortly a bunch of organizations that if you're interested in donating to support the efforts in India, the Keto Fund, GiveIndia.org, the Goonj.org, the Desai Foundation, all are doing great work in terms of helping with COVID relief efforts. So please donate. And I agree, Huma. I had a friend who is a humanitarian worker that was in India, and I asked her if she wanted to come on the show. She said, I'm not ready. Like I'm not ready for that yet. I mean, I can't even imagine what that's like. So again, my heart is with you. I'm going to check in on you tomorrow.
Thank you so much. Thank you so
All
much.
right. We're going to bring in Babita. Take care, Huma. Bye-bye.
Thank you. Thank you. Bye-bye.
Wow, that was hard not to start crying, frankly. What an amazing, incredible journalist. That was Huma. She's a senior journalist in India with decades of experience covering foreign policy. And she was just educating us on what is the scene right now in New Delhi, what is going on the ground, how did this happen so quickly. But the last thing that she started talking about is journalism and how do journalists put themselves in harm's way and have that bravery. So I want to bring on one of those people. Babita Patel is a humanitarian photographer who documents social issues around the world. She's covered criminal justice reform, education, gender equity, reproductive rights, veterans, disaster relief, and WASH programs. Her work has appeared on ABC, Al Jazeera, HBO, MSNBC, and New York One and PBS. Not as prestigious as Samantha Politics, but I'll take it. And The Guardian, The Marshall Project, The New York Times, Slate, and The Washington Post. She's also the author of Breaking Out in Prison, which is a book about criminal justice reform, systemic racism, and community investment. She's also the founder and executive director of the Kai-O Project, an NGO that advances gender equality in economically challenged communities. And we're going to ask her about that at the end. And she's also launching Kahani with actually a friend of mine, Tara Abrams, which is a new print magazine of stories for girls by girls from around the world to inform, elevate, and inspire one another. So without further ado, welcome to the show, Babita.
Thank you so much for having me, especially after talking with Huma. I'm speechless.
It's just tremendous what is going on there, and the fear, and mental health is real. So the last thing that Babita or that Huma and I were talking about was the risk that journalists put themselves at to get these evocative photos so that the outside community can know about them to then do something. So can you talk about, I know you're not reporting on India, but some of the situations you've been in, and how do you have the bravery to kind of go into those situations, even if you're in harm's way?
It's probably indescribable. We just know that those stories need to be told. And if it's not me who's telling them, who can tell them? Especially if I have the connections, the experience to be there, and also the knowledge of what it's like to be there and the situation that's going on. There has to be just something that you do. There's been moments when I've gone into places, whether it's a slum in Haiti, where I know I'm going to be interacting with the drug lord that runs the neighborhood there, or situations where you just know that there's going to be military checkpoints and they may or may not let you through. And depending on how friendly they feel towards you at that moment, it could end really badly. And it's just a matter of knowing that these stories need to be told in order to change public opinion, which ultimately ends up changing, policymakers' minds, because they'll follow the public opinion.
So basically, how important it is for that to be able to influence policy. So something else, and this is just an interesting question that I didn't tell you about, but some people in India have referred to this disaster as a failure of imagination. And I think you could say that about the COVID crisis as a whole, is that we didn't imagine, we just never imagined that this could happen. How do you think that through storytelling and photography and visual, we could increase our imagination to prevent crises like this?
That's a really interesting question. And thinking about imagination, there were a few people that called this out from the beginning, or even beforehand. There was a reason why there was a office in the White House that dealt with the potential pandemics. It is a matter of listening to the voices that sound a little bit crazy, because who would have thought that something would, eviscerate the world in this manner? Then the other part of it is telling the stories and also remembering them. We went through this 100 years ago with the Spanish flu, and
Right.
the same things that Huma's calling out this time around is the same things that we're supposed to do. Back then they also said social distancing and masking up were the ways to combat the disease. And this time around, it's the same things, and we knew it. If we listened to history, we knew it, but we just didn't care to pay attention to it.
Mm-mm. I think that's a really good point about remembering, and I always talk about too. This just pisses me off how every country you go to, it's always a never again. It's like you're the Holocaust, never again. Then you're in Peru, it's a never again. The Spanish Inquisition, it's a never again. It's like, can't these countries learn from each other also? Like, do we all have to have a never again? Like that also just strikes me of learning across borders. I mean, if we think about Ebola, for example, I mean, we lucked out big time in the US of not having an Ebola outbreak. I mean, that was also extremely fatal, if not more fatal than COVID. And we,
Yeah.
lucked out. But seeing that could happen in Africa, it was like, oh, is that Africa? That's not going to happen here. I mean, and some of that maybe is imperialist type thinking of like, oh, well, that can't happen here. I don't know.
There's an always it's an over there way of thinking until it happens here.
Right.
There's plenty of things that probably in the past few years that we didn't think would happen here, but it did. Just because we got complacent.
Yeah. What do you think? I mean, you're Indian American. Uh, we talked a little bit about culture. What do you think about in terms of the cultural norms of contributing to the massive spread of this virus in India?
Yeah, that's interesting, because I know when the lockdown started a year ago, part of me was skeptical. I have family in India. I visited there a lot for um, vacation purposes and also for work. And so I know the culture, and I didn't think that they would be able to really social distance. Uh, if you just even think about it in terms of sheer numbers, the U.S. Census just came out. There's 330 million Americans in this country. India has 1.3 billion. So that's an extra billion that we don't have. And their land mass is smaller than ours. I think it's a third of the size of the US. So when you just think of that, adding a billion people and shrinking our country down by a third,
It's good
how
image.
do you social distance? And then on top of that, if you're a culture that's not used to socially distancing, there's some cultures around the world that are just very affectionate and also very on top of each other, and you live in generational families. It's not just 4 people in one home. You usually have like 6 to 7 or 8, because you have grandparents all the way down to kids, and potentially even other siblings or aunts and uncles and stuff. And so when you're just that crowded in spaces, and as Huma pointed out, she's like, the rooms are even smaller. So how do you contain something where you need space in order to contain it?
Yeah, such an interesting point. So I want to move and talk about just the role of imagery and storytelling in prompting international attention, aid, and intervention. Uh, so I want to show a slideshow of images that are really famous images that have all been pivotal in prompting international attention, especially U.S. Either military troops or intervention. I just want to say, if you are somebody who's very sensitive to graphic images, these are pretty awful and disturbing. Or if you have kids around, I would just not keep them at the screen while we take a look at this slideshow. So Zach, if you could just show that slideshow. And again, these are just pivotal images in U.S. history that have prompted U.S. policy and intervention on particular humanitarian issues. So, a couple of the images that we're seeing here is a little boy refugee washed up on the shore, who's dead. And, what do you think that was? I mean, I know, my impression of that, realizing the international community of like, we can't just ignore Syrian refugees and pretend that like they're going to go away because they're dying and like this is a little boy. Can you talk about, and a lot of the images too feature like one person. It's like it's focused on one boy, one person. Can you talk about that in terms of the power of that?
Yeah, there's numbers and stats make a difference, of course, and in understanding the giant scope of things. You mentioned some of India's COVID numbers earlier, but 300,000 cases. None of us know 300,000 people. We don't understand what that looks like, visually. But if you could show me one person, like that little boy, unfortunately, who passed away on the shores, all of a sudden that one person becomes real. Like I can know one person, I can know one person's story. And then if you tell me, oh, multiply that by 300,000, then I'm going to understand it. But first I need to know one person in order to feel that connection. Because, humans, we are a storytelling species, from our earliest ancestors. And once we connect with one person through hearing their story or seeing their life, then all of a sudden I'm going to be able to extrapolate that to sheer numbers and then see the scope of it and see the need that needs to see the work that needs to happen in order to address the need.
Yeah, and then in terms of like policy change, so you also see the starving. Was that Somalia or
Sudan?
That was Sudan.
Yeah.
In terms of like, what do you think the role is of photography in prompting international policy change or policy at all?
It is one of those things that until we see it, we don't know how bad it is. We could hear about it and we're busy Americans. We have our own lives to live and it seems like, oh, where's Sudan on the map? It seems so far away. How do I relate to it? I don't know someone from Sudan. It's easy to not dismiss it, but to walk away or give away our responsibility. But then once we see an image, all of a sudden you see this human being, whether it's a child, whether it's an adult, but usually the child is the one that pulls us more in. All of a sudden we could start asking for things from our leaders, that this child does not need to die this way. This child does not need to starve. This child needs an education or frankly, just medical care, oxygen,
That's a really good point about how children are extremely evocative in terms of people's sympathies and and that can be used in a negative way too, of kind of that women and children are always kind of on the front of the Save the Children catalog because that's what prompts international attention. But if you put a bunch of 18-year-old male migrants from somewhere, it's like, bah, who cares about them? And it's like they're all the same system, their families, this is all related.
It's really easy to exploit children, especially through photography, especially since they don't usually give the right to use their images, and they don't really understand what that means, and no one's asked them of that. And also, frankly, their parents are probably not being asked either because of the situation. But children, are innocent in our eyes and deserve everything because they have a bright, big future in our eyes. And so when we see them in pain or hurt, we're going to react differently.
With regards to that, what do you think of some of the other photos, like the photo of the mother kind of being up against the thing at the border and the little kid kind of like sitting there? That's also like, I think, an interesting like kind of familial image that it evokes of like, this is a family and like this is what they're going through.
Again, I think we all knew that there was a problem at the border as Americans and it's not like something that just started in the past 4 years of the Trump presidency. It's been going on for decades. We don't really understand it until all of a sudden you see a little girl crying because her mother is, I don't know if she got arrested from at that point, probably she did, but, and it's even more telling that we don't see the faces of the mother or the Border Patrol. And we just focus in again on the story of this little girl crying because obviously the situation is stressful. She doesn't understand what's going on. And also she probably picks up on the fear and the uncertainty that her mother has in that point. So I think a story like that, the photographer did a whole photo essay, and spent so much time at the border. But that one photo just speaks to us in a completely different way, because now it's not just, unknown adults fleeing the country, their home country, and trying to get into the US, quote unquote, illegally or whatever. All of a sudden, it's a 2-year-old girl crying.
Yeah, and I remember just in general how it really took journalists going down to the border during the Trump administration to expose what the heck was going on in terms of child separation and what was going on in detention facilities that weren't detention facilities. They were like offices that didn't have showers and didn't have toothbrushes. I mean, that was really the work of journalists of exposing that.
So, if you think about it, just in terms of like science, our minds think in terms of pictures. If I say dog, you don't see the letters D-O-G, you think of like a golden retriever.
Right.
So when you hear like, oh, an office building is now housing kids, like, yeah, that sounds terrible, but I don't really understand what that looks like until you show me the picture. And all of a sudden I see just how terrible it is. And now I need to do something about it.
I want to go back quickly to, as I'm looking at these photos of people gasping for air on ventilators in Indian hospitals, I mean, and gosh, that BBC video where that girl is trying to shake her brother and to wake up, who's not getting medical care and then realizes he's dead. Like, it's just awful. How do you, like, I can't imagine like going up to somebody and like taking a picture of them as like their relative is dying. And it's a similar thing with the exploitation of the child. Like, how do you get those images without feeling like you're exploiting this like really serious, extremely sad moment?
It is a very, very fine line on what to do in those situations as a photographer. And I will be honest, I know plenty of photojournalists who've had serious PTSD from the work that we do. And like that picture of the boy in Sudan with the vulture in the background, that photographer, even though he won a Pulitzer Prize for that image, had some serious mental health issues afterwards and committed suicide, I believe. Oof. So this is not an easy profession to do, because for that reason, you see abject poverty, the worst of what a human could go through, and your job is just to document it. Like, how do you not?
You can't do anything,
and we don't even have the resources to do something. Like we could just be a body that's a bystander without the camera, but just there not doing anything. And there have been times, especially during when I photographed disaster relief, and there's volunteers there that are digging rubble out of a home and helping to like rebuild someone's life, and I'm just there with a camera, and I'm not the one, basically in the fireman brigade there of like, moving one piece of rubble to the next, or helping a family find a missing loved one or a pet. And it hurts when you get dinged for something, for doing your job. But I also have to remember that without me being there doing my job, people might not know what's going on. Only maybe the 10, 15 volunteers or the local police might know. But like, how do we get more attention to this, to get those dollars in, to get federal activation going from the agencies, to get, frankly, resources into these communities that need it?
Yeah.
It's really hard, and it hurts sometimes to be that person.
What does it feel like as an Indian American to, listen to Huma? And I'm sure you have family still in India.
I have family. I'm also, I think I mentioned to you, I'm working on a project with probably about 10 or 11 people in India, and we connect every day. Even today, I realized in the past few weeks, half the team shows up for our meetings because they're sick, they have COVID, and they can't make it to the meetings. And it hurts to know that it's like that. And all I can do is I donate to organizations in India because I can't be there physically to do anything. And so if I can give money that could get masks into slums, get hand sanitizer into people who don't have it, like that's something I don't know how to get an oxygen tank to someone, and I don't want to interrupt that distribution chain, but I can donate to someone who can do it, get all the necessities, the PPE, because they're doing the work on the ground.
Yeah, and like we said before in the Facebook chat, there is a list of organizations to donate to. I want to end on a little bit more of a positive note because this has been such a depressing episode. I mean, most of them are, but let's end a little bit more of a positive note. Tell us about your nonprofit, your photography nonprofit, and what you're doing there.
Yeah, thank you so much for asking about it. It's called Kio Project. That's Kioo. It's a Swahili word. It means mirror. And through the work that I do as a photographer, I came to realize like what happens when a kid holds the camera. And this little thought sparked all of a sudden a nonprofit that works on gender equality. So we teach photography to girls, and then the girls teach boys. It changes the leadership model.
The power dynamic has shifted.
Total power dynamic has shifted. And it's really, we started this about 8-10 years ago before the conversation really turned to including boys and men in the conversation about gender equality. So when we started, we were like one of the first, and we knew that it's not enough for girls just to be equal with each other. If we only give opportunities just to girls without including the boys, without having boys see them in these leadership roles and see this as normal, And so the workshop that we run has been really powerful in changing not just the girls, self-confidence levels or leadership skills, but also for the boys to see these girls with knowledge that they want to learn from and to accept them as a leader in their community.
That's so cool. Babita, how can people support your work at Kio?
Oh, well, thank you so much. If they go to Kio Project, that's KIOO project.org, there's always a donate button. We're also always looking for, partnerships. We're always looking for new locations for us to run our program because we run our program all over the world. We ran a program in South India a few years ago. We do a lot of programming in different African countries. So we're always looking for new partners. And, we're always looking for not just program partners, but also potentially companies that are interested in promoting gender equality, whether it's a camera company or it could be even, something like Dove that promotes gender equality through both women and men. So we're really interested in promoting, using both genders or all genders to talk about gender equality. We can't only have one gender work on the issue.
Thank you so much, Babita. And another show I want you to talk about criminal justice reform because I'm really interested, but not on this show. I want to thank you so much for being a guest on Samantha Politics, for supporting, awareness of global politics and gender equality. And I look forward to continuing to follow you in your journey and your amazing photography.
Well, thank you so much, especially for the kind words and for including me in this conversation. I'm amazed by what you're doing and how you distill down what's going on in the world to make it understandable to an audience.
Thank you. I appreciate that. Hopefully it was. All right. Take care, Babita.
Thank you.
Bye-bye. Wow, what an episode. That was Babita Patel, who is a humanitarian photographer and a nonprofit leader who runs the Kio Foundation. Before her, we had Huma, who is a senior correspondent in New Delhi, India, reporting from what the scene is like on the ground. I want to try to sum up this episode, but it's really hard. I think thinking about what Huma said about this is a global pandemic, that, India helped the US needs to help India. We all need to help each other. This is not something that one country can beat on its own. People travel across borders, shutting down the borders doesn't necessarily really work anymore. So, again, and I think it's also just for people in the US and people in other countries realizing that this isn't over yet. Just because we're vaccinated does not mean that we're out of the dark yet, and to not be complacent, to follow whatever President Biden does say tonight on his State of the Union regarding mask wearing in the United States, but to also realize that some other people have other countries are still really struggling with this in a really catastrophic way. So again, I encourage you to donate to the organizations we mentioned. There's even more than that. The giveindia.org has a list of different organizations that you can donate to, so you can see what organization you're donating to. But all of those are doing really great disaster relief work and are verified foundations through my networks that I know that have been on the ground in India. I want to also say that this show is dedicated to Renu Bhatt, the loving mother of Tapish Bhatt, who died from COVID on April 24th in India. She was from Haldwani, India, and that I'm thinking of the Bhatt family during this difficult time. Lastly, I want to thank our sponsors that enable this show to happen. So the amazing stream inspectors, whenever you hear me call, Zach, can you please do this? That's Zach, who's the head of stream inspectors. They are the leaders in live stream production. If you're looking to have live stream production done or to create something like this, they are the ones to call. Again, they are stream inspectors. The other amazing sponsor that we have is Trillium Solutions. Trillium Solutions is an amazing learning and development company. Their website is trilliumcreativesolutions.com, headed by a fantastic feminist entrepreneur that just treats her staff like amazingly, and they do great work, and they take on lots of pro bono projects in terms of web design and graphics and all sorts of different things. Definitely encourage you to use them if you're looking for a learning and development solution. I realize that this show is also sponsored by my company, Empower Global, which does diversity and inclusion training for companies. So if you're looking for diversity and inclusion training for your company to become more aware, global citizens, to develop cross-cultural awareness, understand their unconscious bias, be more empathetic, please, I encourage you to email our company, Empower Global, and our website is www.empowerglobal.net, as the revenue from doing workshops does help us support production and marketing of this show. And I think that's it. So lastly, if you enjoyed this episode, I know enjoy is not a great word for this episode. If you found this episode enlightening, I would just ask, please like us on Facebook. That enables us to get sponsorships. Please share, subscribe if you're watching this on YouTube. Please follow us on Twitch if you're on Twitch, and please share this with your friends. It's really important that we are all dedicated to solving this together, and India is really in a state of crisis right now and needs all of our help. So thank you so much for watching. It's such a pleasure to be able to be with you here every week, and we'll see you next week on the next episode of Samantha Politics on Wednesday at 7 p.m. Take care, everyone. Bye-bye.